The most dangerous thing about lung failure is not how it ends. It is how quietly it begins. That is exactly what makes lung failure so dangerous. Not the dramatic moments, the quiet ones. There are 10 specific warning signs that doctors say should never be ignored. And at least 3 of them are things you have probably already noticed, but brushed aside. So stay with us, because what you learn in the next few minutes could genuinely change what happens next for you or someone you love. Here is the first thing most people get wrong. They assume shortness of breath means struggling to breathe at rest. Like you cannot catch your breath just sitting in a chair. But real lung trouble almost always starts much earlier than that. It starts when activities that used to feel easy suddenly feel hard. Climbing a flight of stairs, walking to the mailbox, carrying groceries from the car. If you find yourself stopping to catch your breath during tasks that never bothered you before, that is your lungs sending a message. Doctors call this exertional dyspnea, and it is often the very first sign that lung function is declining. The lungs are no longer moving oxygen efficiently enough to meet the body's demands during physical effort. Your heart rate goes up, your chest feels tight, and you need a moment to recover. That pattern deserves attention, not a shrug. Closely connected to that is rapid or shallow breathing. When oxygen levels begin to drop, the brain sends a signal to breathe faster. This sounds helpful, but shallow, rapid breaths often make things worse. They move less air, deliver less oxygen, and force the breathing muscles to work overtime. Soon, those muscles get tired, and the cycle gets harder to break on its own. Now, here is something that surprises a lot of people. A persistent cough can be an early lung warning sign even if you do not feel sick. Many people chalk up a nagging cough to allergies, a dry house, or just getting older. But a cough that has lasted more than 3 weeks, especially one that produces thick mucus or any amount of blood, deserves a doctor's evaluation. Chronic lung conditions, including COPD and pulmonary fibrosis, often begin with exactly this kind of cough. One that seems minor but simply never goes away. Here is one that most people miss entirely, and it matters more than most doctors spend time explaining. Extreme fatigue. Not just feeling tired after a busy day. We are talking about exhaustion that comes on after simple activities. For walking to the bathroom, having a short conversation, folding laundry. When the lungs are failing, the entire body gets less oxygen, and without adequate oxygen, the cells that produce energy cannot do their job. Muscles feel heavy, concentration gets foggy. Even small tasks feel like they require far more effort than they should. For older adults especially, this kind of fatigue gets written off as just getting older, but it is a red flag that needs to be ruled out before you accept it as normal. Connected to fatigue is something you might notice in the mirror or when putting on your shoes, swelling in the ankles, feet, or lower legs. When the lungs are struggling, the heart has to work harder to compensate. Over time, that added strain on the heart can cause fluid to back up into the lower body, a condition called peripheral edema. This is a sign that both the heart and lungs may be under serious stress at the same time. If your legs are puffier at the end of the day, or your shoes suddenly feel tight, do not dismiss it. Wheezing is another sign that people often live with far too long before doing something about it. That high-pitched whistling sound when you breathe, especially on the exhale, means air is struggling to pass through narrowed airways. It can also come with rattling or crackling sounds when breathing deeply. Neither of those sounds is normal. Both mean airflow is being compromised, and both are worth bringing up with your doctor. And then there is chest pain or tightness. People often assume chest pain means heart trouble, and it certainly can. But the lungs and heart share close quarters. Inflammation around the lung lining has reduced oxygen delivery to the heart muscle, and the sheer physical effort of labored breathing can all produce chest discomfort. It can range from a dull pressure to a sharp pain that worsens when you take a deep breath or cough. Never guess on chest pain. Always get it checked. Now for 2 signs that are harder to notice, but can tell doctors a great deal about what has been happening inside the body over time. The first is called finger clubbing. Over months or years of low oxygen levels, the fingertips can begin to change shape. They become rounder and wider, and the nails begin to curve downward, creating a bulb-like appearance. Most people never notice this happening because it is so gradual, but it is essentially a physical record of long-term oxygen deprivation. Doctors look for it specifically when screening for chronic lung disease, which is why it is worth checking your own hands from time to time. The second sign is cyanosis, and this one is urgent. Cyanosis is a bluish or grayish tint that appears around the lips, fingernails, or skin when oxygen in the blood drops to a critically dangerous level. This is not something to wait on. If you or someone near you develops blue-tinged lips or fingertips, that is a medical emergency. Call for help immediately. Here is the most important thing to take away from everything we just covered. These warning signs do not all show up at once, and they rarely look dramatic at first. They appear gradually, one at a time, sometimes spread over months or years, and because of that, most people delay getting help until things have become serious. By the time symptoms feel undeniable, significant damage may already be done. You do not have to be one of them. Protecting your lung health is something you can take real action on starting right now. Avoiding smoke, staying physically active in ways appropriate for your age, keeping up with vaccinations, and scheduling regular checkups all make a measurable difference. But knowledge is always the starting point. And if any of what we covered today sounds familiar, the right move is to bring it to your doctor's attention now rather than later. If you want to go further and build a complete foundation for your health after 60, our course, Regain Your Health and Vitality, even after 60 covers respiratory health, energy, heart function, and much more with the same evidence-based approach you see in every one of our videos. The link is right below. Your lungs work every minute of every day for you. They never take a break. It is worth learning how to protect them. The video now showing in the upper right of your screen is worth watching. It might be the most important video you watch this year.